My dear friends, this is the part 2 of my series on health management. I hope you got some time from your busy schedules to watch the part 1 of this series. Just to recap, in the first part of this series, we had very briefly discussed the following points. Number 1, human's lifespan. Number 2, increase in average lifespan. Number 3, global centenarians population. Number 4, aging hazards. And number 5, leading causes of deaths. All the statistics, leading causes of deaths, increasing average ages, increasing population of centenarians in the world, and aging hazards indicate the following facts. Number 1, most of the causes of death are controllable or preventable or at least manageable. Number 2, anyone can reach the age of 100 if he follows the medical advices and tips on healthy living. Number 3, life expectancy has increased due to awareness about health tips, scientific developments, and spending on healthcare services by various countries. Now, the question arises that why most of us don't reach that average age which is prevailing in most of the developed countries. It is a very debatable issue, but one thing is certain, that one can extend his life by implementing the most proven strategies of life extension, and this is only possible through health management. Now we will discuss strategies for health management. We have gone through the introduction portion, then we found the details about aging hazards along with causes of deaths by rank. All the details indicate one thing, that the health can be managed to one's benefit, and if proper strategies are adopted, one can lead a healthy long life, which is of course a blessing. As mentioned earlier, you are welcomed by the society only till you are productive to the human beings, and you can only be productive till you are enjoying good health. There are numerous books on longevity, healthy lifestyles, and various strategies to lead a healthy life, with lot of debates on these topics. I have come to the conclusion that in simple, understandable words, the strategies for health management can be categorized in 5 broad areas. Number 1, consultation with the doctor and medical examinations. Number 2, vaccinations. Number 3, dietary guidelines. Number 4, antioxidants and other supplements. Number 5, lifestyle changes. We will briefly discuss each strategy. So, number 1, consultation with doctor and medical examinations. The most important thing is to consult your doctor and get all the suggested medical examinations for your age. This is the only way to know where you are heading in terms of your health conditions and what actions need to be taken to manage your health. Some of the basic tests would be blood test, lipid profile, renal profile, liver profile, blood glucose levels including HbA1c, urine analysis, stool test, ECG, BMD, stress test and echocardiogram, pulmonary function test, abdominal ultrasound, chest X-ray, prostate-related tests, colonoscopy, mammogram and pap test for ladies in addition to other tests. Your family doctor or personal physician is the best person to suggest what medical examinations are required for your age and keeping in view your medical conditions. So, after the tests, a second consultation would be required once all the medical test reports are ready. Remember, doctors are very busy. They don't have much time. So, all the points should be handy and ready on a paper written neatly for discussion. Then carefully discuss the reports with your doctor and note down his recommendations. Second, keep a file for all the reports and recommendations of doctor. Next, before visit to doctor office, make a list of the questions you want to ask him about your health conditions or any issues you feel. This is very important so that you don't forget any specific point which you want to discuss with your doctor. Next, get prescription for medications if any required for you. Next, discuss any supplements or vitamins required for your conditions and age. Personally, all along, I used to make a comprehensive list of all points to be discussed with the doctor, and I used to carry with me a medical profile with all relevant information and a file for discussion with the family doctor. So, next is vaccination. Vaccines are scientific breakthrough in health management and to prevent from various illnesses. A number of vaccines are recommended to be taken at various ages. One must contact his family doctor or check various health websites to know which vaccines are required and how long they protect you from the disease. And also to know that when it is necessary to get a repeat. This is the easiest way of protection from various life-threatening disease, and one must get all required vaccines as soon as possible, noting this task an important things to do list because life is the most important thing for you. There are some seasonal vaccines also, like flu shot, etc., which must also be taken as soon as possible. Some of the vaccines required for adults are tetanus, diphtheria, pertussis. Tetanus and diphtheria has to be taken or repeated every 10 years, flu shot every fall, pneumonia vaccine, shingles vaccine, these are taken at 65. So again, you must discuss with your doctor that what vaccines you have already taken and what other vaccines are required for your age. In this clip, we had categorized the strategies for health management in 5 broad areas, and we have already briefly discussed first 2 in this clip, and the remaining will be discussed in next videos. That's all for today. In the next clip, we will continue our discussion on the remaining strategies of health management. Please do subscribe my channel and favor me with your observations or any comments which will help me in improving my channel. Thank you very much once again.